My name is Russell Pachynski. I'm an assistant professor in the Division of Oncology here at Washington University School of Medicine in St. Louis. I treat genitourinary malignancies, mostly focusing on prostate cancer and immunotherapy. My lab focuses on generally leukocyte trafficking, but prostate cancer models, tumor immunology, and then some translational aspects. It's complicated. It's, no question, an important pandemic, and the lockdowns and social distancing and preventative measures that are happening are obviously important to flatten the curve and reduce the peak strain on the healthcare system. That being said, in the absence of universal testing, in the absence of a vaccine, and understanding that this will be something we have to deal with for several months, if not, the next year or so, it actually is significantly impacting certainly academic centers and other businesses, but also the medical community as well. So, patients that are afraid to come into the clinic because they might get exposed to someone who has COVID, well, they may be delaying their care, and that plays into the kind of, medical economics. So if patients aren't coming in for visits or to be seen or to get their chemotherapy, et cetera, that obviously impacts our ability to provide care. And so, there's a risk benefit. So I think we're going to have to do a lot on not only the testing front and isolating patients that test positive, and a lot of that will be improved with a serology test, with an antibody test, and with universal testing. Now, how long will that take? I mean, it's not been quick thus far, so it could be a while, and then we'll have to, make sure there are standard things that we follow in clinic moving forward. In the absence of that, right now, I think what is happening is has been a pretty strong reaction to this pandemic, an appropriate reaction. But what will have to happen prior to getting the vaccine, prior to getting universal testing, is we're going to have to adapt to the new reality of having COVID there with us in clinic. And so the patients that right now are saying, I'm not going to come in no matter what, in the near future, we're going to have to say, look, there's no vaccine, maybe we don't have universal testing, but you know what, we need to resume some level of normal cancer care. And so it's complicated. I think from the patient perspective, we've been really minimizing the in-clinic interactions. So if someone can come in and get their blood drawn and get their shot or infusion, and otherwise is doing well and doesn't necessarily need to wait in the clinic waiting room to see me in the clinic room, to sit there and ask them, how are they feeling? How's your breathing? Then we can minimize the number of people and the amount of time that they spend in the clinic area to try and reduce the potential exposure and spread. And so there's been a lot more telemedicine. There's been a lot more calling patients and just discussing and then documenting in the medical record. And so it is it is becoming, more remote in a lot of ways. Um, and that can be good or bad. There are a lot of patients and physicians that really enjoy that face-to-face personal interaction, and now a lot of it is being done, by telephone and checking the labs in the computer. And so it's definitely a shift. I think the biggest thing is really just, um, making sure they know all the facts, all the data um, about COVID risks. I think there's a lot of misinformation out there. Um, again, there are some patients that, um, will refuse to come into the clinic, even though they're scheduled to get their potentially life-saving chemotherapy or immunotherapy or whatnot, for the fear of getting exposed to COVID. And and so you have to let them know kind of the risks and benefits of each. In fact, with good precautions, the risk of getting infected, is low. In some of the groups of people, the risk of mortality from COVID is low. Obviously, with cancer patients and comorbidities and increasing age, that goes up. But again, you have to weigh that against their active cancer, or their adjuvant treatment or whatnot. And so I think really talking to patients about the actual, risks, what they can mitigate, or what they can do to mitigate those exposure risks, I think really helps people deal with that. At least on the medical provider side of things, and at least here at WashU and in the medical community, there's been, um, just a ton of discussion and resources and information available. I think for for the community, I think it's really important to get out, um, a lot of this information. A lot of it that we see is complicated and medical, and it's terminology, and so it would be difficult, um, in some regards, for patients to really understand some of it. And so I think there needs to be, um, you know probably a a better way for, certainly for cancer patients to understand, you know sheltering at home is great, but treating your cancer is also great. And so again, just understanding, what they can do to mitigate risks, what the actual risks are, and then understanding that, this, again, without a vaccine and universal testing, this is something that will have to, become part of our normal, um, patterns of behavior for at least the next several months, if not, a year or so. Um, so I think there's, a lot of work to be done between the medical community and patient groups. There's been so much, press and I don't want to say fear mongering, because it's not necessarily fear mongering, but it's we see this every day in every aspect of our lives, and the media. You walk outside, you see it, and so I think there's probably a lot more doom and gloom out there, and so I think, especially when you're dealing with an active cancer that needs appropriate treatment, um, you just have to understand the risk of COVID is a potential one, right? So even if you had an exposure to someone who was positive, um, the infection rates are not 100%, if you're within 6 feet, right? Now, if you've got an active cancer that is progressing and needs treatment, you 100% have an active cancer that is growing. So again, there are some people out there that have kind of refused to come to clinic for their potentially life-saving treatment. And I think, the, what people see and think about and have fears about with respect to COVID need to be reasonably weighed and considered against the the real, you know, the real risk of not treating your cancer appropriately. We have had a few patients who have been so afraid of getting exposed to COVID that they've actually been skipping their treatment. And I think situations like that where the rationale just um, doesn't support their practice of a small risk of getting exposed to COVID and a smaller risk of getting affected by COVID, weighed up against you have an active cancer that needs treatment. And so hopefully, as we get more, as we get people more educated, those types of situations will become lessened.